Hello, I'm Sam Shah from the NHS in England. I'm the Director of Digital Development and I'm really looking forward to the Expo. At the Expo I'm going to be discussing patient user experience and what it is the NHS is doing. Some of you might have heard we've just issued our long-term plan, which goes alongside our Secretary of State's Health and Care Technology vision. These two things together demonstrate the NHS's commitment to being data-driven and also our digitisation. We know globally that to make digital transformation happen, we have to combine the best of our resources with the data-driven approach alongside the needs of our population. But to do this, we need to know our needs of our population. So what are we doing? Currently, we're working on a number of programs. Some of those things are about improving access to services, some of those are about connecting our services together, and we're also trying to improve the way our clinicians work when they come into contact with patients. We've got programs focusing on apps and the NHS app itself, as well as other consumer-facing products that will allow patients to connect with clinicians throughout the NHS. We've got better ways of connecting up the NHS, including our data, the ability to book, prescribe, and even access records. And alongside that, we've got those things that we're doing to improve the way in which we help people when they connect with our emergency services, whether that's 999, 111, or our new online service. All of these things require data. Of course, some new things coming, and that's the way in which we use precision prevention, digital public health as different ways of engaging with the population to make people feel better. But at the same time, we're doing lots of things to improve our existing services. So the outcomes for our population is really important to us. And we know that by being data-driven, focused on user needs, we can improve the overall health and well-being of the population. Thank you.